Hello everyone and welcome to this audio podcast. This audio podcast is part of the lab coat. This audio podcast as part of a Storm Proxil. This audio podcast is part of a Lab N Ostix analysis. This audio podcast is part of the Click. This audio podcast as part of a ZtormLabostix production. Through this audio podcast, look at works in around 2021, works by Mohammed and team from 2021, looking at education empowerment, practice excellence, and practice review. In this audio podcast, a look at a summary of this in around this publication. So the review sought to the publication or the review sought to inform whether it is advantageous to involve multidisciplinary teams, MDTs, in online consultations and/or educational in around educational themes, or in around aspects pertaining to educational themes, and through the Renal Patient Support Group, RPSG, platform, and to improve practices and health and in around health in around by way of seeing a heightened basis in around health literacy, and and between healthcare professionals as well as healthcare service users. So support for recipients with long-term or long-standing conditions from healthcare professionals can be multifaceted. However, despite the efforts between in around RPSG and KDOS platforms, this has not directly propagated healthcare professionals or practitioners to change readiness to interact through online spaces and or valuing communication with patients or recipients, and perhaps except a few healthcare practitioners from perhaps where they learn from discussions through the social media platforms. Therefore, where recipients would normally see more than one multidisciplinary team professional or MDT professional for an aspect of care. This publication informs therefore of how recipients would find it or can find it advantageous to schedule time with allied healthcare professional or AHP, who can at least provide or offer a basis in around educational services, where there can be fragmentation between physical consultations with healthcare professionals, and in around online and where healthcare services could be or can be part of a way to integrate electronic patient records with electronic patient records or EPRs, with a sense of e-health. At the same time, irrespective of the pandemic, digital efforts surrounding the RPSG platform have been founded in around since 2009, and it was in this publication that led to the developing of a inquiry to understand educational support surrounding CKD patients online. That draws this audio podcast to a close. This audio podcast as part of the lab coat. This audio podcast as part of a Storm Proxil. This audio podcast as part of a Lab N Ostix analysis. This audio podcast as part of the Click, and this audio podcast as part of a ZtormLabostix production.